Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along. Also glad to be joined this afternoon by our regular Monday panel, I suppose we could say. The Mayor of London, Ed Holder, is here, the Warden of Middlesex County, Cathy Burghardt-Jesson, the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Mackie, and Carol Young-Ritchie, Executive Vice President, Chief Clinical Officer, and Chief Nursing Executive at London Health Sciences Centre. Glad to have the media along this afternoon as well, and we invite you to submit your questions using the question forum here on Microsoft Teams. Just click on the text bubble with the question mark to submit your question, and please do indicate your name, your media outlet, and who your question is for. And finally, a greeting this Monday afternoon to those who are tuning in on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, AM 980 CFPL, and those who are watching on the CTV London website. Let's get to our opening remarks, and we'll start today with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. So after providing additional signage and caution tape, I'm pleased to say there were no violations observed by our bylaw officers on City of London golf courses over the weekend. In fact, even the basketball courts were quiet. Look, I know it's frustrating. I know it's not easy at times. But let me say I'd like to thank all Londoners for your recreational sacrifices over the weekend for the purposes of public health and safety. As I said before, whether you agree with the provincial orders or you don't, they are the law. But beyond that, it was relatively quiet, although we did have one 26-year-old man charged with attending a gathering at a residence on Lyle Street. You know, today marks the beginning of National Nursing Week, and this year's theme is, and I'll quote, "We answer the call." That could not be more fitting. We've never needed nurses more than we do right now. We've never asked for more from them than we have during these times. And yet, here they are. They have answered the call, hour after hour, day after day, month after month. And that's every facet of nursing, from community and acute care to education and innovation. I think of the 4,000 nurses at LHSC who keep showing up, working incredibly long hours. They miss their family members and they make significant sacrifices, all while under immense stress and scrutiny. I know I join all Londoners in offering my most profound thanks and my deepest admiration for all nurses here in London, Middlesex, across the country during National Nursing Week. And lastly, today, I'd like to highlight a tremendous virtual meeting I had last week with approximately 50 faith-based leaders from various backgrounds about the importance of encouraging their members to get the first vaccine available to them. I was joined on the call by my council colleague, Steve Turner, who appeared in his role as Director of Environmental and Infectious Diseases. The conversation was very productive, it was honest, and ultimately encouraging. As we've been seeing since vaccines were made available, an overwhelming majority of Londoners across all ages, backgrounds, and faiths want to get vaccinated and are getting vaccinated. My message remains simple and remains the same. Wear your mask, physically distance, wash your hands, don't have friends over, and get the first vaccine available. So that's it for me. Over to you, if I might, Warden Cathy.
Great. Well, thanks so much, Mayor Ed. And as always, it's great to be with you on what looks to be a very sunny Monday. As this week's week marks National Nursing Week, it is only right that we take a moment to acknowledge all of the nurses in our healthcare system. Whether you are a nurse in a doctor's office, a nurse in a long-term care home, a nurse working for public health, or a nurse working within our hospital system, we say thank you. If the last 15 months have taught us anything, it is not to take our nurses for granted. Certainly, this year's theme, as acknowledged by Mayor Holder, "We answered the call," couldn't be more true. You have been on the front lines of the pandemic, no matter where you are nursing. Your compassion and dedication is what is getting our healthcare system through. Somehow the words "thank you" do not seem adequate. If you have a nurse in your circle, then take the time to acknowledge them. As it seems every week, we have been teased by great spring weather, but I know that we are all anxious to get out and get beyond the lockdown. We don't know what the next 10 days will bring and what direction the province will go with the lockdown. Certainly, listening to Minister Elliott earlier, my advice would be to hope for the best, but prepare for the worst. It is clear there are pockets in the province that are still struggling through this pandemic. Even in Middlesex-London, the roller coaster of cases only shows us that we are still on this ride. So in preparing for spring and summer, always support local where you can. As has been emphasized so many times by myself and the mayor, our local retailers and services have adapted to continue to be able to serve you safely, even through restrictions. So don't forget about them. Invest with them to ensure their doors will be open when allowed. As always, remain physically distant, wash your hands. If you show COVID symptoms, get tested. If you are ill, stay home. Keep your bubble tight. Please always stay home, just going out for essential services. Reach out to a friend. Order takeout from a local eatery. Mask up, and when you are eligible, book your vaccine. Dr. Mackie, great to see you this Monday afternoon.
Thank you very much, Madam Warden and Mr. Mayor. As always, your comments are much appreciated, and I'll join you in wishing all of our nurses and nurses across the region a very happy Nursing Week. We have another happy announcement today, and that is that we've now vaccinated 216,000 people in this region, about 188,000 through the mass clinics, 188.5 thousand. 22,000 through pharmacies, and about 5.5 thousand through primary care, family doctors' offices, and places like that. That's a tremendous accomplishment, and it actually represents 51% of the adults in this region. That's total vaccinations given, so there have been second doses among there, and we know we vaccinated some people from outside of the region. But the fact that we've delivered enough vaccine for more than half of the adult population is an enormous accomplishment, and one that all the healthcare sector partners involved should be very proud, and also one that everyone who came down to the clinics to roll up their sleeve should be very proud of as well. As with every part of the COVID response, the public interest and support is a major driver of success or failure. Three major announcements you would have seen through the public service announcement that we released earlier today around upcoming eligibility. First of all, that as of Tuesday, all essential workers will be now eligible. A big part of that announcement is we'll be changing the process so that the essential workers who work in any of those Group 1 or Group 2 essential worker populations will no longer need a booking code. They will be able to book through self-attestation, essentially swearing that they are eligible through that eligibility of the essential workers, and that will give them access as of 8 a.m. tomorrow morning to our booking site. At the same time, the individuals with at-risk healthcare conditions will also become eligible. It's a very large group that includes, respiratory issues, diabetes, a whole bunch of other conditions. Those individuals will become eligible at 8 a.m. tomorrow morning as well. And you will also have the same attestation process. They'll have to swear that they're eligible as somebody with a high-risk healthcare condition. And they'll be able to book through the covidvaccinelm.ca website. There's a third group, and that is the individuals above age 40. So far, our mass clinics have only offered to people 50 and above, as well as people that are eligible through other criteria. That drops down on Thursday morning at 8 a.m. to 40 and above. So all three of those are in alignment with the provincial changes, which were also announced this morning. There is a fourth group that will become eligible, this for second doses. A large group of healthcare providers that are deemed by the province to be high-risk essential healthcare providers will become eligible on Friday to start booking their second doses earlier if they choose to do so. It's not all healthcare providers, it's only those that are in high-risk frontline positions. The eligibility is, as always, at healthunit.com for those that would like to reference that list. That group of healthcare providers for second doses becomes eligible to book as of Friday, 8 a.m. Because they're rescheduling, not scheduling for the first time, those healthcare providers will have to use the phone line. So there's no online rescheduling of appointments. They will have to phone through to the phone line. So those are the major eligibility updates. We also are announcing that we believe eligibility for the 30+ group will open up next Thursday. That will be, if I'm doing the math correctly, the 20th of May. So as of the 20th of May, people who are 30 and above will be eligible based on their age. And as always, that's based on their birth year. So that's people born 1991 or earlier. And then the following Thursday, the 27th, we will open up to everyone 18 and above. Now, the 30th, the 20th for the 30+ population and the 27th for the 18+ population are still pending provincial confirmation, but those are the dates that we believe that we will be able to open, and that is what we are planning for now. I want to thank all of the media who've been so helpful in getting the eligibility information out in the past. These are, some of our last major eligibility announcements, and we're very grateful if you're able to help us promote those with the public. That's it for me for now, Dan. I'm happy to pass to Carrie Young-Ritchie.
Hi, good afternoon, and thank you for this opportunity to join today's briefing to provide an update on the COVID-19 situation at London Health Sciences Centre. I want to start off by wishing a very happy National Nursing Week to more than 7,000 nurses who work across a number of organizations within our community. As LHSC's Chief Nursing Executive, I'm particularly proud to have been witness to our nurses rising to the challenge of this year's national theme, We Answer the Call. To put it simply, the safe and high quality care we've delivered in the face of this global public health emergency would not have been possible without the unwavering dedication of our nursing teams. To all nurses and to all nurses across the world, I'd like to say you are seen, you are valued, and I want to thank you for all you do in the service of health needs of our communities. As of this morning, we have been caring for 86 COVID-19 positive inpatients, 40 of which are in critical care. Of the 86 patients, 60 are from within our region and 26 have been transferred to us from outside of the region. While we are encouraged by the early signs of stabilization that are emerging across the system, it's important to note that we are stabilizing at a point where hospital numbers are still very high across the province. And so we find ourselves at a significant juncture. Whether this period of stability will lead to a downturn will depend on the actions of our communities. We encourage everyone to do their part by continuing to adhere to the stay-at-home order and follow the long-standing public health guidance to limit personal contact outside of our immediate household, wash hands, wear a mask, physical distance, and book a vaccine appointment as soon as you're eligible. With your ongoing support, we are cautiously optimistic that there'll be better days ahead as we look at the next couple of weeks. In the interim, our team are keeping a focus on supporting the province and its effort to load balance patients across the broader hospital system. As always, our hospitals are safe and our emergency departments are open 24 hours a day, 7 days a week. Do not delay in seeking care for medical emergencies. We are here and we have the capacity to care for you. Thank you.
Thank you very much, Carol. Thank you, Dr. Mackie, Mayor Holder, and Warden Burghardt-Jesson. Well, we do have a lot of questions, so let's get to those right away. And the first question, looks like the first series of questions from Jennifer Beeman. Dr. Mackie, first off, how many appointments will be available when this mega group of workers in at-risk health conditions becomes eligible tomorrow morning at 8 a.m.? How about later in the week with the 40+ and fast-track second appointments for some of those priority healthcare workers?
Sure. So we have 30,000 appointments available in the system for the group that we'll be opening up to tomorrow. That's over the next 4 weeks. The tail end of those 4 weeks have additional appointments that will become open as we get closer to those dates. And so we are confident that we'll have enough for the opening tomorrow morning. Thursday will be a little bit more pressure, but again, with the 40+ group, you've had a lot of opportunity to book AstraZeneca through primary care and through pharmacies. And so, the 28,000 or so vaccines that have gone out through that population are, vaccines that have largely gone to that group from 40 to age 60. And so we do anticipate that there will be a huge increase in people booking on Thursday with the 40+, but it won't necessarily be all of that population. Some of them have already been vaccinated.
Thank you very much. Let's go to the next question, and it's a follow-up, Dr. Mackie. How many vaccine doses is the health unit receiving this week, and do we have a line of sight on vaccine doses we're receiving next week?
Yeah, we have had some up and downs in terms of the provincial support for releasing those numbers. I can tell you that this week we're getting over 12,000 Pfizer. We also are expecting in the range of 10,000 Moderna. We've actually had an additional 1,000 Moderna or so, 1,200 or so that have been released for primary care in particular this week, and working with primary care practitioners to make sure that we can get those 1,200 vaccines into arms by the end of the week, by end of day on Saturday is the goal.
Thank you very much. And one more from Jen Beeman for you, Dr. Mackie. The number of Brazilian variants reported in the London area jumped from 9 late last week to 16. Has there been spread of the variant here? What accounts for that increase?
Yeah, we can say with some certainty there has been spread here. Jennifer, this is not a situation where we have a lot of travel associated cases. Most of those cases were acquired locally. So, like other COVID viruses, no doubt that this is circulating in our community right now.
Thank you very much. Let's go to the next question. Carol Young-Ritchie, this is for you from Jen Beeman. Is LHSC still taking in out-of-town patient transfers? And I think you mentioned that a bit in your opening remarks. How many is it expecting to take this week?
Yes, we are continuing to still take patients from the Greater Toronto area. That has slowed down a little bit. We are continuing, we assess it daily, and we are expecting to take patients this week, probably between 5 and 10.
All right, and Jen does have a follow-up. What is London Health Sciences Centre current surgical volume? Are you anticipating further reductions? Will be necessary in the coming weeks?
Yeah, we're guided by Directive 2 from the Ministry of Health, so we have reduced our surgical capacity to 50%, and we're doing urgent and emergent cases. We don't anticipate reducing any further, and actually we're looking for a revision of Directive 2 and anticipating that sometime this week.
Thank you very much. Let's go to our next question. This one comes to us from Kelly Wong at Global News Radio 980 CFPL. Dr. Mackie, today's local case update is surprisingly low with just 27 cases. Is this a sign that the stay-at-home order is working? And can you provide any insight into why today's case count is so low?
Appreciate the question, Kelly. We don't have an excellent answer. We've seen the case counts vary throughout the pandemic, in part because of how the lab processes. We don't have a great explanation as to why, there were over 100 cases reported on Saturday and less than 30 cases reported on Sunday. What we can say is that, when we're looking at the direction of this pandemic, we really do consider a full week's worth of data. There is weekly variation because of the number of lab tests that happen during the week being higher than the testing on the weekend. And so you've got to really take a week's worth of data into consideration. And what that points to, if you look at the last 3-4 weeks consistently, is we are now on the decline. With today's, the case counts over the last week, are definitely lower than the previous week. It's not the decline that all of us are hoping for. We definitely want to see those numbers accelerating downwards more quickly, but it is moving in the right direction.
Thank you very much, Dr. Mackie. Let's go to a follow-up question from Kelly Wong. And I know there's another question about this in the queue as well, and I'm going to ask them because they've come up, but I know that there's not any additional information. So Dr. Mackie from Kelly, is the health unit able to provide an update on whether the 18-year-old who died with COVID last week had any pre-existing conditions?
So there are a couple of things that I need to think about as I answer this question, Dan. One is the confidentiality of a minor. That's something we always consider when we're communicating about this issue. You have seen some reporting of this publicly. There was an article in the Free Press that indicated they had spoken with the family, the family didn't report any pre-existing health conditions. We haven't completed our investigation here, and we wouldn't necessarily release that information in any case.
Thank you. And there was another question there that did have some information that the health unit has not disclosed publicly. So with that understanding, I'm not going to publish it, but the question was very similar and asked about variants of concern. And again, Dr. Mackie, as you mentioned, there's not a lot of information beyond what the health unit has already provided. So I will move that one as well. So let's go to the next question. This one is from Brent Lale at CTV London. Dr. Mackie, with more and more teens getting sick from COVID recently, is it important to get young people vaccinated as soon as possible on May 27th when they are eligible, or even sooner?
Absolutely. Absolutely, Brent. It's very important that we get young people vaccinated as soon as possible. Right now, we're working with the provincial eligibility directions, and it looks like May 27th will be when we'll be able to start booking people 18 to 30. And we very much hope that that group books as quickly as they possibly can.
Thank you very much, Dr. Mackie. And there's a question here, a follow-up from Brent Lale. Carol, this one is for you. Ms. Young-Ritchie, there are reports which indicate a pair of teens are in pediatric ICU at LHSC. Can you confirm, and do you have any information to share about these cases? And these would be, of course, COVID-19 cases.
No, I don't have any information to share due to reasons of confidentiality.
Thank you very much. All right, let's go to a question from Craig Needles at Blackburn News for Dr. Mackie. Dr. Mackie, does quiet basketball courts, as the mayor pointed out at the start of the briefing today, actually help to limit the spread of COVID-19?
It definitely helps. When we see people making good decisions not to gather, whether it's indoors or outdoors right now, it's really important that people respect those public health directions. And the fact that we're seeing that is a huge positive for our community. We are seeing decline in cases. That is because people are making good decisions. So a big thanks to everyone who's choosing not to gather at all.
Thank you, Dr. Mackie. And I do want to mention to the media that we are getting down to the end of the questions that are currently in the queue. So if you have been waiting for your opportunity to submit a question, now would be that time. So get those questions in if you have been thinking about doing so. Dr. Mackie, follow-up question from Craig Needles. At the end of April, the province indicated adults over the age of 18 in Ontario would be eligible for the vaccination by May 27th. The internet dropped out briefly for Craig as I'm reading his question. Yes, Craig, that actually is the plan. May 27th is when the Middlesex-London Health Unit is planning to make the vaccine eligibility open for those 18 years of age and older. Glad I could, it's funny, we've all experienced that, haven't we, where the internet is fine and then all of a sudden it drops out. So Craig, yep, you missed that part, but hopefully that does answer your question. Next question is from Jennifer Beeman. Dr. Mackie, do you have a timeline for the Earl Nichols opening? Will that opening be key to making appointments available to the 18 and over crowd that is coming up at the end of the month?
Yeah, thanks for the question, Jennifer. We are very close to being able to announce a timeline for Nichols. I would anticipate that we have that timeline to share with you by our Thursday briefing.
So there we go. News to come, as they say. All right, well, that does bring us to the end of today's questions. So we thank you very much, Mayor Holder, Madam Warden, Ms. Young-Ritchie, and Dr. Mackie for joining us this afternoon. Our next virtual media briefing is this coming Thursday, excuse me. That would be the 13th of May. We will see you then. I will have my tongue untied by that time and look forward to speaking to you then. So between now and then, have a great rest of the afternoon. And so long for now.